You can see the pictures on the nightly news, and it seems so abstract. Those people are so real to me because you were able to see that, you were able to smell that, you were able to feel that. We were very close to the front line of fighting, and you could feel it sometimes. You could hear it. We knew that our service and our calling was going to be to Eastern Ukraine, but they did not tell us exactly where that would be. They did not want to disclose the city or the location, basically due to safety concerns. So we flew into Poland, took a bus into Kyiv, spent a few hours in Kyiv undergoing security briefings. Early the next morning, we boarded 2 buses and got on the move to Eastern Ukraine. When we drove in, you could really see the destruction to the family settings, to the houses, to the apartment buildings, the schools. Even the building that we were in had some significant damage from, again, the war and the occupation. But in the hospital, we were so globally focused on the patient and really trying to help. Again, Samaritan's Purse is so well set up. And again, we're not just mentoring to the physical needs and doing surgery. We were really trying to bring some light in the darkness. There were many, many patients just coming in for routine health care. Many people that needed diabetes medicines, high blood pressure medicines. They haven't been seen by a physician in many, many months. On top of that, there were so many people that had suffered from frostbite. They had been through a very harsh winter. And then there was an abundance of patients coming in, believe it or not, that had survived close encounter attacks, but still had shrapnel and metal pieces really throughout their body. Sometimes these pieces of metal had become infected. Sometimes they had affected their ability to walk and maneuver or function. So we had multiple patients coming in with these shrapnel wounds. Interestingly enough, I'm going to remember this lady really for the rest of my life. She was moving around kind of in the early morning time. It fell and subsequently broke her thigh bone or her femur. So she was actually brought into our hospital. She did undergo an operation. The operation was very successful, so we put a plate and screws on her thigh bone, and she spent about 4 or 5 days in the hospital. And that lady grabbed a hold of me, and I thought maybe she was never going to let me come back home to the United States. She just held me, and she was just, again, the appreciation was there. Inside that damaged, bombed out building that we slept in the basement, it was so powerful. That thought of, wow, I'm in a real war zone and I'm in a danger zone, just never really crossed my mind. I would walk back tomorrow. If they called and said there was an opportunity, I would put it all on the line. I would dedicate myself. I'd walk out of here and I would get on that flight to make that happen again. That people are in just desperate need. They need somebody there to show them something different than what they're going through.